Hi, I'm Dr. Marian Owen, and I'm putting together this video for my patients on February 29th, leap year day, 2020, about COVID-19 virus, which has just come out as spreading in California. And that is, of course, of great concern, and especially since we don't know how this virus is going to change over time, how virulent it really is. We really don't have good information, so it's extra frightening for people. So I've been getting a lot of questions from patients about how to prepare, what they should do, and I want to try and address all those questions here. So it's going to be kind of a long video. If you want to cut to the chase, just go to the cdc.gov website and read everything there, because that's kind of what I did to prepare for this. At the end, I'm going to talk about things that are unique to our practice, nutritional ways to prepare your body for a virus, and also things to do if you were to get sick to help your immune system. And so that will also be included here at the very end. So if you just want to jump to the end, you might want to do that. But so here we go. The COVID virus is in the coronavirus family. Viruses are little tiny particles that when they get into a living thing that they can infect, take over a cell's manufacturing centers to make copies of themselves. They then break that cell and spread on. Outside of the human body, they're really not alive, technically. They can't do anything on their own. So they're this weird thing that only when they're in a cell or infecting an organism can they live. So viruses, there's not much we can do about them to kill them. And in some viruses, we have developed like specific drugs for this specific virus, like in HIV, we have protease inhibitors and other things that block the enzymes that type of virus uses to replicate. But with this particular coronavirus, we don't have that. We don't have a drug that has been developed that will help you fight this. So there's nothing I can call in for you should you get sick that will make you get less sick. So, and antibiotics, which kill bacteria, should be called antibacterials, do not affect viruses, and so they are not useful in this setting. The only time an antibiotic would become useful after a COVID infection would be if it causes a pneumonia or a sinus infection. And that would be if you've been sick for 7 days and you're getting worse and worse, if you've been, and you're getting higher and higher fevers rather than better and better. If you have locked in pain in one location, sinuses are here, 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 here. So if you have locked in pain there and you're getting nasty purulent drainage, that's a sinus infection. If your cough is getting worse and worse, your fever is getting higher and higher after the initial days of illness and you were starting to get better and then you suddenly get worse, that might be pneumonia, bacterial pneumonia that I can call in antibiotics that might help you. But the flu virus itself and COVID virus are viruses that infect the lungs and they cause a pneumonia, but that pneumonia is viral and antibacterials do not treat that. So if you get severe infection with COVID virus, which it does seem some people are, specifically seems to be older people and less healthy people, but that's not entirely the group of people who are dying from this. So as of now, what I would say is if in the early stages of the illness, like in the first few days of being sick, you have severe illness, like feel like you're short of breath, feel like your fever is just really, really high and it won't come down with ibuprofen and you're just not able to care for yourself, that is when you go to the emergency room. And there they can do supportive care, meaning giving you IV fluids should you need it, medicine to keep your fevers down, and respiratory support if you need it. But again, there's not going to be a drug that they have that is going to make it stop in those early few days. So I think that is enough background on what COVID virus is. I'm going to check my notes and make sure that I've covered what I wanted to. Oh, okay, spread. So the reason this virus spreads really easily is because it spreads through respiratory droplets. So a lot of people are getting message, well, you need to get a mask and cover your face all the time. Well, if someone sneezes on you, it's not necessarily the respiratory droplets that you breathe in that moment that make you sick. It's the ones that deposit all over your body and onto your face and hands that then when you take the mask off, you're going to touch your face to take the mask off and it's going to make you sick. So the mask does not prevent. Also, there's gaps in the mask that don't fit right, blah, blah, blah. But there's no benefit to you in walking around in a mask. It will not prevent you getting ill. but there is benefit to you in avoiding people who are coughing and sneezing. So if you are caring for a loved one and they are sick, you want to avoid touching the surfaces of the room that they're in. You want to wash your hands, wash your face well after you've been exposed to them. You don't want to carry the respiratory droplets that they cough onto you through the rest of the house. So if they were to put on a mask when you go in to take care of them, that would keep it from getting onto you. You be careful about the surfaces you touch. They wear a mask when you walk in so they don't cough right in your face. And that's how you avoid getting sick when you're caring for someone. So that's why in the doctor's office, we will put on a mask and gloves when we're taking care of people, because we can't go immediately take a shower after you leave. So that is how it spreads, and that's how to protect yourself. But you don't need to spend $300 on a mask on Amazon right now. The mortality rate of the COVID-19 virus does seem to be relatively high. It's much higher than the flu typically is. Right now, it's being circulated that it's probably 2.9%. It may be significantly lower than that because we might not be testing everyone who has it, because in most people, it's a pretty mild infection, it seems. And so we're really only testing people who get very, very sick. And of those people that we've tested, it does seem to be about 2.9%. But again, there could be a million people out there that we didn't test, that just didn't get all sick enough to get a test. We just have no idea at this point, and that will probably come out in post hoc analysis after it's spread around a little bit. But I suspect the mortality rate is actually lower than that current reported 2.9%. But let's just go with 2.9%. It's bad. You want to not get it. At this point, there is no shot to prevent that like there is for the flu. But that doesn't mean you need to panic. You need to prepare. So the CDC is recommending, if you haven't gotten your flu shot, that you do so. The flu shot does not protect you against COVID-19, but I guess their reasoning is you don't want to get it and the flu at the same time. That would make it worse. You also don't want to get the flu and not be sure if you have the flu or coronavirus, and that can get confusing. And so let's go ahead and get the flu shot so we don't have to worry about that. So if you're inclined to get the flu shot, go ahead and do that if you haven't done that yet this season. Also, do healthy things. Get outside and exercise. I don't think you need to go to a gym class right now and breathe on everybody and share weight machines and stuff like that. But do get outside in the sunshine. It's a beautiful day today. Get out there, exercise, walk around. Just don't walk up to people and go, hey, how you doing? You want to kind of give people space. You don't want their respiratory droplets on you. Other thing to do to help your immune system is to stress less. So do the things that make you happy, that you enjoy. I enjoy cooking, so I'm making chicken soup today. I'm going to freeze up some in case we get sick. We like chicken soup when we're sick. So things that you enjoy doing, do that. But avoid unnecessary large group gatherings. You don't need to be doing that right now. We don't know how far it's spread. I think we can't know. So just be reasonable. You want to continue your hopefully healthy habit of eating clean, colorful foods that like fruits and vegetables that have a lot of color are supportive of the immune system. Herbs, spices, garlic, onion support immune system functions. Mushrooms, any mushroom you like, have cell wall components that specifically help the immune system function. So if you like those things, eat those things. Encourage yourself to eat them even if you don't really like them, because that is a way to stay healthy. And make sure that you're getting enough sleep. So don't stay up late on Facebook worrying about COVID-19. Go to bed and get your sleep so you can prevent getting sick from the COVID-19. And then I do recommend that, within sane limits, you do some stocking up of things that are non-perishable that you can eat should there be a large outbreak and you don't want to go to the grocery store. So shelf-stable milks, flour, sugar, things that you could make bread, that you can cook for your family, dry beans, dry grains, frozen things. There's no reason to think the power is going to go off, so you can put frozen things away, canned goods away. Make things that you like to eat and freeze them for later. If the virus doesn't come and we don't have the vipocalypse, then great. You can get them out of the freezer later and eat them. No harm, no foul. So get things that you would normally eat. Don't go getting things you don't want, but get them and have them in stock. Should things get crazy, you don't have to go to the grocery store. And honestly, I think if things do get really bad, like if we have isolations and things like that, or we're staying home from school, trying not to go places because it spreads very far, which could happen, probably food delivery services are not going to be operating. So you need to be prepared to prepare food for your family. Supplements that you can take on a regular basis that tend to support the immune system. N-acetylcysteine, let me get that in the light. N-acetylcysteine, I like this brand because it's the cheapest one I can find on Wellavate. And I, through cold and flu season, take one twice a day because that's what a teeny tiny study said prevented people from getting symptoms of the flu. I'm for that. I don't want to get symptoms of the flu. Don't mind getting the flu, rather not be sick. So NAC did that in a small study in old people. That's exactly who gets really sick from the flu. So I'm like, great. Very, very, very few side effects from this. I've never had anyone not tolerate it. I think I can say that. I've never had anyone not tolerate it, and it's something I recommend all the time. You can order this on Wellavate through our website at wellavate.me through the Whole Family Medicine account that we have set up for you. If you don't have that account, you need help with that, give us a call. We'll get you set up, no problem. Vitamin C. I'm not unique to this brand. I don't care, but vitamin C... Let's see, this is a chewable that I got for my kids probably 6 years ago. It's been around the house ever since then. It's not going to go bad. I'm sure it has an expiration date that I'm sure I'm past, but it's still vitamin C and I'm not worried about it. So this is a chewable. I don't care if it's a chewable. I don't care what kind of vitamin C, ester C, C with bioflavonoids, blah, 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 blah. When you're sick, it doesn't matter. I mean, there's lots of theoretical reasons why you might want one or another. But you just want some vitamin C, help your immune system function. The dose, when you're not sick, during cold and flu season, 1, 2 a day. When you are sick, I take about 500 milligrams, 600 milligrams every 4 hours. If I start getting loose stool, cut back on the dose. Because if you're getting loose stool, that's vitamin C unabsorbed, flushing through you. You don't need it doing that. You just need to take as much as you can absorb. Vitamin C peaks and then goes away over a 4-hour period of time. That's why you need to dose it multiple times during the day. So that's that. So those are the things I do regularly in addition to sleep, stress reduction, exercise, good diet that will help your immune system be prepared if you were to get sick. This is something that I do keep around my house that has had some small studies that indicate that it might help fight off flu. Since coronavirus is similar to a flu virus, if me or one of my loved ones is going to get sick in the next few weeks as this is kind of stirring along, I'm going to give them this. Can't hurt, might help. It's expensive. That's the downside to it. I'm sure it's flying off the shelves, so maybe you can find some. You can definitely order it on Wellavate, so look for it there. I also try to keep around my house some form of an antiviral. All of these things are things that I currently have in my house and have and do recommend. I'm seeing things backwards, so I'm not doing a very good job. So Immunotone by Designs for Health. How much? Whatever it says on the back of the bottle, that's the dose. So Immunotone Plus, all of these have some combination of the following herbs. They've got astragalus, they've got echinacea, they've got andrographis, elderberry, golden seal. This one also has some mushroom extract. So if you don't like to eat mushrooms, this is a nice one to get. So this one, they all say you can take them regularly, but I don't think you should because there's stuff in here you don't need regularly. But if you were to get sick, any one of these has some combination of those, and all of those have some data that they help. So Immunotone Plus by Designs for Health, Olivirex by Biobotanical Research, that's their name. Viracid, been keeping this in the office. We're not able to order any right now, but you can get it by the bottle, and I think Emerson still has some. People have been loving this during our flu season this year. So again, I don't know that it will work for COVID, but since it's a coronavirus and so is the flu, it's reasonable to think it will. And then Pure Defense by Pure Encapsulations. This has some NAC in it. So if you do this, it doesn't have a lot. You would still take one twice a day of the other NAC to get good high doses. But any of those would be helpful. And then you also want to pre-prepare with things just to help with your cold and flu symptoms. So have around a neti pot or a sinus wash or whatever it is you like. I like to put a little drop or two of iodine in there to flush through because that kills things. I like to keep some herbal drops. This, Ricola, Fisherman's Friend, they all rock. My son doesn't like this one, and because it's very strong, but I like it because it's very strong. So this will knock out a cough. But I do the Fisherman's Friend, any of those too, and then elderberry cough syrup. This can be very, very helpful as well. Honey is also really good for cough. Herbs that are good for cough that you can put into a cough syrup. And any of these, all of these, some of these, none of these, whatever. Thyme, thyme, sage, cinnamon, clove. So you just boil whatever of those you have in some hot water and let it steep for like 15 minutes and drain the herb out. Mix in a lot of honey, mix in some lemon juice, make it taste good. And then have a teaspoon of it when you need it. There's nothing magical. There's no like, this is the recipe. Just kind of make that. It's, make a nice strong kind of tea decoction. Let it sit for a long time and then strain the herbs. It's not rocket science. Once you have been sick, if you get severely sick, call us. We would rather you not come into the office sick. So we'd rather intercept and manage over the phone if we can, if we're not sure what's going on. Depending on what the public health advice is at the time, we may do a house call. We may advise you to go to the emergency room. It depends on what the public health system is telling us to do. But we would rather sick people not walk through our door coughing. We do have masks for you to put on, but we'd also rather intercept that and manage you out of the office if possible. So do rest, take your vitamins, give yourself plenty of time to recover. Once you are recovered enough that you haven't had a fever for 24 hours, you can emerge back into society, wipe down the room you've been in really well with antiviral wipes. There are some natural versions of that I prefer, and you can find those on Emerson as well. And then you are going to cough. After a viral pneumonia, you're going to cough. You're going to cough for 2 weeks, 3 weeks, 4 weeks. And I'm sorry that you're going to cough. You just are. There are things that we can prescribe that might cut down on the coughing. But as long as it's just a cough and you're not producing tons and tons of mucus and you don't have a high fever still, you're just coughing, that's just your lungs healing, and it's going to take some time, and you're going to have to be patient. And yes, it stinks, but there it is. Your body has to heal after something like this. This is a new virus for it. It hasn't seen it before. It's going to be confused, and the virus is going to knock it back a little bit. But you've been taking care of that good body of yours. That good body of yours is going to come back strong. You're going to be fine. So I've already discussed when to go to the emergency room. When to call us is when you feel like you need us. If you have a question, if you have a concern, give us a call. If you're really sick, we would rather you call before you come in. Don't just come in, because we don't want to spread the virus at our office. And so again, we would maybe come see you if that seems appropriate. We might send you to the emergency room depending on what the health department and the CDC are advising at that time. I'm going to quick look over my notes. Y'all can watch that. Oh, don't take mega doses of vitamin D. There's no evidence for that. If your vitamin D is good, and we've told you on your physical exam that your vitamin D is fine, you've been taking about 2,000 a day, clicking along, you don't suddenly need 10,000 a day. Yes, vitamin D helps your immune system, but it's not some's good, more's better. You need the right amount. Just take your right amount. And I think those were all the things I wanted to say to you. If I have left anything out and you have questions, if you have concerns that come up, please reach out to us. We're happy to answer them. But if you, and if you want to share this video, that's fine. I'm only sending this to active patients, but I don't care who you send it to. That's great. But please do keep in mind, these are just my ideas, my thoughts, my recommendations, and that cdc.gov is where you're going to keep up with the latest and greatest. This is what we know when we know it. This is, again, being taped on February 29th, 2020. If things change, I will reach back out to you guys. I hope that you're able to enjoy the rest of this absolutely gorgeous weekend, and we look forward to hearing from you if you have any questions.